Good afternoon, everyone.
Hello.
Hello, everyone.
Hello.
Hi, Kevin.
Hello.
Hello.
I'm getting no volume. Can others hear me?
We can hear you.
Yes.
Yes.
Can someone else speak?
Yes, can you hear me?
Yes.
I'm not getting any volume.
Hello, Kevin. Can you hear me?
I'm going to exit and come right back. Hopefully it'll work. All right. I can hear now. I will note that it's saying live on YouTube, so we may or may not already be live streaming. So if the public's watching, give us a second here. We're just waiting for the rest to arrive. Let's see here. I believe we are missing Raheem. Is Judge Brennan joining us? Is Judge Brennan on?
Yes, I am present.
Good afternoon, Your Honor.
Good afternoon.
And then I think we are Let's see. By my count, that would be everyone. Gang, are we missing anyone else aside from Raheem? Okay, well, let's get rolling. We are 3 minutes past the start point. So are we all ready? All right. Well, then I will call the February meeting of the Jail Oversight Board of Delaware County to order. First item on the agenda is a Pledge of Allegiance. You rise. I pledge allegiance to
Pledge
the flag
allegiance to the flag of the United States of America
and
and to the republic
which it
for
stands,
which it stands,
one
one
nation,
nation,
under God,
under God,
indivisible,
indivisible,
with
with liberty and justice for all.
Thank you, everyone. The next item on the agenda is our public comments. And as always, we have 2 times for public comment. We have public comment at the outset, which is only to be read on items that are going to be on the agenda, since that gives the opportunity for the public to address things that we're about to vote on. And then at the end, they can be on items whether they're on the agenda or not on the agenda. And if the public can bear with me momentarily here, I will check the email address. And as always, for people who are watching and would like to get a comment in before the end of the meeting, please send your comments to JOB, as in Jail Oversight Board, at co.delaware.pa.us. Again, JOB at co.delaware.pa.us. And when you do so, please say your name and your address so that we can put it into the records. And if others have access to their emails, I see one that came in at 4:09 p.m., but that's not something on the agenda. Other than that, does anyone see anything else that would be a relevant comment? Okay. If not, the next item on the agenda is the approval of minutes for January 2021. Is there a motion to approve the minutes?
I make a motion to approve the minutes of January 2021.
Thank you, Deborah. We have a motion. Is there a second?
Second.
Thank you. Was that, who made that second? Sheriff?
Jerry Sanders.
Okay. Thank you, Jerry. Motion is second. Any questions or comments? Hearing none, all in favor?
Aye.
Aye.
Any opposed? The ayes have it. The next item on the agenda is approval of the reports for January 2021. Again, is there a motion to approve?
I'll make the motion.
Thank you, Your Honor. Motion, is there a second?
Second.
Thank you, Joanne. Motion is second. Questions or comments? Hearing none, all in favor?
Aye.
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 Any opposed? Again, the ayes have it. Item number 3 is, or I should say, item number 4 is approval of the staffing penalties for January 2021. Warden Tatum, would you mind telling us about our penalty for January?
Yes, the penalties were totaled $123,539.39, which is down significantly from December. December was over $200,000. Staffing rate continued at 95%, and the effective rate rose 1% to 85%. That is considering all the staff that are on leave.
You said it's at 85%?
Yes, sir.
Okay. And that's the effective, that's after taking into account people on leave.
Yes, sir.
Okay. Still low. And therefore the penalty, and you said it was, sorry, it was 100 and what?
$123,539.
Which may be down from December, but it's still substantially higher than it had been.
Yes.
Okay. Is there a motion to approve the staffing penalty?
I
Make a
second the
motion to approve those penalties.
those penalties.
Thank you, Sheriff, and thank you, Raheem. Motion is second. Any questions or comments on the staffing penalties? I guess I just have one. I mean, Lee, do you have any guidance on, I know that I appreciate that it's down and therefore the staffing levels are a bit better, but this is again, the recurring theme of as long as I've been watching jail oversight boardings before I was even on the jail oversight board or it even came into existence. Is there anything further of note about what GEO is doing to take corrective action?
Well, they are recruiting, and I know that we are bringing in a significant number of interviews. I would say we're trending, as I said at the last meeting, the trend I believe is going to be downward. And I suspect that for February will be even lower. So I think it's on the right path. GEO is working hard to recruit, and we are seeing new staff come in.
Okay. Well, I will believe it when I see it. Is there any other questions or comments? Hearing none, all in favor?
Aye.
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 Are there any opposed? The ayes have it. All right, the next item is coronavirus update. Warden Tatum?
Well, quite a bit since the last month. On January 14th, myself and Kelly Shaw did a webinar on COVID-19 POD training. And so, of course, I told you before, we are a POD site. There's some training that needs to be done for our medical staff. And we also need to get the refrigeration units or the freezer units in order to preserve the vaccines once we get them. But hopefully we'll get those in plenty of time before the vaccines become available to us. On January 28th, myself and facility leadership, we had a conference with Rosemary Holt, who is the Delaware County COVID-19 Task Force Director. And we had a meeting about strategies on disseminating the vaccine here. One of the things that came up was the expansion of the 1A category, which does impact our timeline in terms of receiving the vaccine. That 1A category apparently is expanded to by about 40%. And so our projections based on our discussions with Ms. Holt is mid to late spring in terms of getting the vaccine at this facility.
So just to, a couple things there. So I think what Ms. Holt's statistic about 40% is that 1A now encompasses 40% of the county. When you include everyone 65 and over, as well as those between the ages of, I can't remember what the lower end is, if it's 18 or 16 and 64 that have certain pre-existing conditions, which include a long host of items that, taken into a whole, it's 40% of the county. And seeing as the jail is not in 1A, and I'm sorry, it's moved around so much. Howard, correct me if I'm wrong about that. I don't believe, I think it's in 1B.
Predominantly, I mean, the staffing, in terms of staffing, we're 1B, but based on individuals, you may be 1A. Some of our our residents are 1A, and we had that discussion as well. And she said she would do her best to facilitate, an expediting of our receiving the vaccines to the max extent possible by contacting certain key personnel in the distribution chain in Delaware County. So she is aware that we do have residents here who are 1A, and she's going to, we're going to work together to see if we can expedite some of those vaccines.
Yeah, and I would also throw into the mix Crozier. I think Crozier should be and can be a helpful source there as well, given I know that's not a part of their contract with the jail, but perhaps they can be another useful member of the community on that. But as you said, I mean, in terms of 1A, across the county, including county administered and non-county administered vaccinations, we're at still under 30,000 people, which is, you're in sort of the range of, what's that, 7-8% of the county versus the 40% figure I mentioned. So you still, regardless of the members of the jail that are within 1A, we're still really in the early stages of 1A, which I think is the general point.
Of course, we've established a plan of distribution once we receive the vaccines. It's going to closely resemble our mass testing we did in April of 2020 for COVID-19. So we have the plan. We're just awaiting the vaccines and ready to roll. Current infections, we did get one new resident who was infected, but we knew about him at intake. He was not infected while here. He came in that way. So he was quarantined. He's currently recovered. For January, we had 4 staff members out for COVID-related issues. 3 were determined to be infected, and 1 is still pending, or 1 was still pending at that time. In terms of our total numbers tested versus positive since March of 2020, total tests among the residents, 1,456. Total infections, 167.
And again, the overwhelming majority of that were in the first few months of the pandemic.
Absolutely.
It's been a trend over the last 3 or 4 months.
Total staff tested, 478. Total staff positives, 110. No inmate deaths to this point. And of course, as I stated last time, 2 staff deaths. Our protocols are still pretty much in place. The one big difference is that we've gone from quarter tier to tier exercises now. So there is a bit more out of cell time currently going on right now.
Lee, did you say half tier or full tier?
Tier. A tier is a half tier.
Half tier. Okay.
Yeah. So we've expanded the out of cell time at this point, and we're going to be looking at doing haircuts and limited movement to law library here in the near future.
Kevin?
This is Deb. Just a comment about accessibility to vaccines. The 3 health systems have a weekly call with Rosemary and members of intercommunity health emergency management. So possibly she could get you in connection with each of the representatives of the 3 health systems that may help in accessing vaccines for those in your 1A group.
Thank you.
If you need them, I can certainly email them to the folks as well, if you'd like after this.
Thank you. Thank you. And the one other item that's changed, weekend sentences have been reinstituted to this point. And that's all I have on COVID right now.
And the weekenders are held in a completely separate area, correct?
Correct.
Yeah, so in terms of concern of that being an entry point for the virus to infect.
Right. No, we will maintain our quarantine protocols.
Yeah.
Absolutely.
Anything else from the board on our efforts on coronavirus?
If I could,
The county overall is got the fourth highest number of vaccinations, first time given in the state. The only two counties that are significantly higher are Allegheny and Montgomery. We do have, interestingly enough, we have a very high percentage of second vaccinations given as well. We're frustrated by the fact that we can't seem, as a county entity, to get more vaccine. And it's something that we need to talk about and how to approach the State Department of Health, who is not very transparent on their decision-making process. So that's part of our frustration. I do agree that, and I talked to Rosemary right before this call, I think approaching Crozer is probably a good strategy to address the need to provide vaccinations for Lee and his population, because according to Rosemary, they have additional vaccines available, which I find kind of strange, but I will talk to her and work on that as well. What we are doing in the case where we have vaccines left over, we do have a standby list for critical personnel. I don't know if that works particularly well for Lee, given that they're isolated, but we'll continue to work on that. But it is really perplexing as to why our vaccine allocations are so low. And I'll pursue that with members of our delegation as well.
Yeah, I echo your frustration. It's been, as you know, Howard, the ongoing conversation amongst council is why we're not getting more of a dosage, and frankly, why so much of what's coming into the county is not coming to the county, that it's going to a lot of these sort of fragmented pharmacies, and it just makes for a very confusing system for the public. But we're going a bit far afield for the jail right now, but it's very frustrating. Anything else from the board?
I just had a question. I was wondering, my understanding is, some of the changes in the categories, but that corrections officers are 1B, but if they're 1A, they should be, registering and signing up for that. And I'm just wondering whether that's been communicated to them so that they know they should, get into that, 1A list somewhere. And where GEO's, communicated that to them.
Yes, it has been. In fact,
Okay.
that is how staff vaccinations are going to be managed through the pre-registration online. And so that's been communicated, everyone's doing it. And obviously there's a survey or questionnaire that indicates health status. And so everyone's been informed of it.
Thank you.
All right, if nothing else on the topic, we'll move to the next item on the agenda, which is the deprivatization update. And with us, as always, is our quarterback on this initiative, our owner's rep, Mr. Majid Al-Sayeh. So I'll turn it to you, sir.
Thank you, Kevin. Current efforts have been focused on getting data from both from GEO and from the county to put together the financial model and critical task schedule. Warden Tatum and GEO have both been good about getting the data to us. CGL has been developing the financial model. They've started putting that together and keeping us informed as to progress. And we'll be reviewing that with you when it gets to be finished. The CGL is also preparing some RFPs for things such as medical services and other contracts that need to be put in place in order to take over the prison. We also met with the president judge, we met with the district attorney and with the public defender to get their input into this process. And we're engaging all of the stakeholders to make sure that they're informed as to how we go forward with this. We're looking forward to next steps.
Imagine when we say financial analysis, it's really sort of the cost and scheduling, or whatever we want to call it, but the timeline of.
Correct. It'll be a cost assessment and schedule for tasks. Yep.
Which would drive an understanding of what that time frame looks like in order to effectuate a transition, and therefore when the county could responsibly trigger the out within the contract and the 180-day window that would start.
Correct, and it will, provide you with the assumptions that go into all of both the financial assessment and the tasks.
And the timing for completing this first phase of the CGL scope is what, Magic?
Well, we had hoped to have it done by the end of February, but it took us a little bit longer to get the initial data transfers, but we're working towards having it completed shortly thereafter.
So it's a realistic, but not, sign in blood that we might be able to have a report to the Jail Oversight Board by next month's meeting?
We will certainly try to have that done.
Okay.
I won't promise, but we're going to try.
Questions from the board?
Evan, one thing we may want to consider is, given the timing of when the report's delivered, and to give the members of the board enough time to review it before making a recommendation, you may want to consider a special call meeting, maybe early March sometime, once we see what the delivery schedule is. It's probably worth the dedication of the time to that singular purpose anyway, given the magnitude of what it'll start in progress. So as we know, with a little more certainty as to when that draft report will come in, I think I'll come back and ask about maybe finding a time to do a special call meeting.
I think that's a good recommendation, but certainly it'll be driven by the timing. So imagine as we have a better sense of delivery date, based on that, we can schedule such a meeting.
We will certainly coordinate with you.
All right. Anything else on this front? Hearing none. We can move along to the subcommittee reports or other subcommittee reports. Any subcommittee chairs have anything to update the board on?
Yes, I have some.
All right.
So we were successful of getting a report of all the programming inside all of the reentry programming, that is, and programming inside the jail, thanks to Warden Tatum. And I got a chance to review a lot of it, and I wanted an opportunity for the board to actually see it as well. I didn't send it to everyone, but I did send it to Joanne and Deborah, and I hope they did receive it. I think it's something that we should really look at really soon, in midst of the transition, to see where we're at in programming, because I'm understanding now that a lot of program is ran by GO, and some programming are ran through like the Delaware County. It's kind of confusing, to tell you the truth, how the budget works, and it's really it's tedious, and I think it's something that we should look at, to try to find out how do we separate / or if we're not even worrying about that in reference to the transition, what programs are there working, what we need to tweak, what we need to change, and what we need to add, and it's missing is, according to my understanding and experience, it's missing a lot of things that it should have. That was my conclusion of reading it.
Thank you, Raheem. My question to that is, as it relates to the work of CGL, I would imagine that a core component of their work is going to be an assessment of the current services being provided and how that compares to what we would envision for a county-operated jail. So I think what you're talking about, Raheem, is vital. I think that folds into what we're going to be doing in the deprivatization work of CGL anyway. But I look to you, Majid, on your thoughts there.
Yes, and Raheem, we have been looking at the programming as well, and also talking to others such as Keith Reeves at Swarthmore and
Okay.
Jen
Great.
at Penn State, and also Jordan Hyatt at Drexel has a lot of information.
Yes, I know Jordan. Yep.
Familiar with Jordan Hyatt?
Mm-hmm.
Yeah, so we're reaching out to kind of collect not just what's happening now with Geo, but what some of the more current studies say about programming, and we want to kind of help you choose what works best for Delaware County.
Thank you so much.
Any other subcommittee updates? Okay. Brian, is there anything on the opioid use MAT expansion versus last month? I don't really think there is. Is there?
I had an opportunity to talk to Laura at the SCA this past week, and she did inform me they're still in conversations with Geo. They brought in some other people like from the Philadelphia prison. They that had expanded MAT there, so they're still in conversations, but nothing has moved forward with anything.
Yeah, and I think my understanding is part of that is to update the grant, right? That the $1.2 million grant that we received, there had to be some adjustments around, the nature of use.
Yes, yes. So they're looking at that to update that, and they're working with and kind of looking at the model what the Philadelphia prison is doing. Laura was talking about that. That has been highlighted as one of the Philadelphia Correctional Prison there is for MAT has been highlighted in a lot of publications and whatnot. And one of the individuals that started that is a professor at a regional college here. So they're reaching out to find out some resources and some assistance as they move forward with adjusting things in the grant. So
yeah, I mean we've had a couple of meetings between the Single County Authority, which is Delaware County's Drug and Alcohol office, plus the GEO team, both locally and nationally, since last month's meeting. And I think there is, the sort of grant update is dual track. It's part and partial. I should say it's separate from, it's just sort of fleshing out the plan for, a launch. So I think there is progress on getting some of the details sort of worked out, but not yet at a point to announce a pilot program with inmates.
good. Thank you.
All right. Anything else? If not, we are on to the warden's report. Mr. Tatum.
Yes. The most current census report indicates a population of 1198. Total commitments for January, 461. Total discharges, 378. Recidivism rate dropped in January 5% to 58%. And in terms of major incidents for the month of January, thank God, none for the month of January. The GTO update indicates 384 video visits for the month of January, and the total to date is 1,650. Additionally, we're going to be establishing 5 more links for visiting in the visiting area through GTL. They started assessing that today. Commissary operations remain robust, normal. Those weekly gift bags are continuing. A behavioral health update indicates we have 3 residents on standby for Northtown Hospital on the waiting list, and our drug and alcohol liaison has discharged 47 residents during the month of January to inpatient treatment. In terms of our Vivitrol program, for the month of January, we had 6 participants. 1 participant completed the program. Our maintenance update, on the 25th, I went out to the pump station to become familiar with that operation out there. I met with KBX staff and Daryl, County, Daryl Harris, I believe his name, and our maintenance manager. We're all out there and took a tour. And the operation seems to be an improved one, apparently. I've been looking at the cost of our operation out there per the Concord Township billing versus the billing after KBX took over. And there's quite a dramatic decrease in funds to this point. So far, so good. They're paying for themselves. Also in January, we had some heating concerns in Unit 5 to the point that we had, it's a computer control issue. And the computer system is pretty dated, so it's hard to find the right hardware for it. But we did move the residents to open units until that was fixed. And so we resolved that issue. Also, there's a generator that was ordered, I think somewhere at the end of 2020, maybe November. And that is projected to come in here early March, mid-March. That generator is supposed to be out at the pump station. Right now, we're renting a generator right now to the tune of about $4,000 to $6,000 a month. So, you know, the quicker we get that in, the better. And that's all the updates I have for right now.
All right. Any questions for the warden? Or comments? Okay, hearing none, we can move on to the next item, which I lost my agenda. I believe we are at the second public comment. And I just took a quick look. I think we have, I've got two emails that I've seen that I think, so the first, and I just lost it. The first was from Mary Austin at 1036 First Avenue in Media. And her question, Mr. Tatum, I think you already answered part of it, and then there was a follow-up question. Her question was, has there been any further investigation into the recent suicide, particularly any action or inaction of staff regarding the incident? And Lee, I don't know if you want to provide that answer that you provided here, or I can read your email that you shared with her, but I just want to be transparent about the question.
Sure. Basically, any time we have an incident of that gravity, there's always an after action review, right? And just typically that starts out with local law enforcement coming in, doing their review of the matter, see that there's no criminality. Once that's done, then there's an administrative review that occurs. And in this case, like any suicide, you always have a senior mental health professional come in and reconstruct the situation and assess the incident to see if the policies and the protocols in place are appropriate and adequate. And if so, are they being followed? Is there any thing that needs to be remedied in terms of staff conduct along those lines? So that always happens. And as far as this last incident in December, that has happened, right? And apparently it is ongoing in terms of decisions regarding, you know, Gio's decision as to regarding what steps, if any, are necessary regarding the staff who performed that evening.
Okay, I mean, but I want to be clear. I think, and I'm going to look to the solicitors here, and sorry to put them on the spot, but I believe that, you know, there would be, from a county perspective, also an insurance that whatever is being done meets the standards per the contract. Would that be an accurate statement?
Yes.
So I don't want the public to think that this is, we're just going to sort of kick it over to Geo. They're going to decide whether they did what they needed to, and then the county sort of accepts that.
So in terms of where they are in decision-making regarding that, I've had conversations with Dave Byrne to this point, and based on the track that they're going, I'm satisfied they're going in the right direction, but it's not something that I would necessarily talk about in public forum because there's privacy concerns for the individual involved.
Yep, understood. Okay, and she had a follow-up question, which I think you just answered, which was, has anything begun on that front? And the answer very clearly is yes.
Yes.
All right, that is the first I see. We also received this afternoon, this is from Lauren McHale, 14 Kathleen Court, Havertown, and her comments are, good evening, JOB members. First, I wanted to offer a belated congratulations to Interim Warden Tatum on his appointment. I also wanted to thank the board for the transparency and expedience. Unlike most meetings in the history of mankind, this monthly assembly is actually productive, informative, and well-governed. Kudos. Well, I'm glad that at least one member of the public feels that way, and we'll always strive to be better, but I appreciate the remarks. And then I think we just got another one here. Bear with me as my email loads. Okay, this is from Jane Dunbar, 232 Garfield Avenue, Norwood, PA 19074. Mr. Tatum, are you aware that stationery, i.e. lined paper, hasn't been available on commissary for the last 2 months? Can you look into that?
I certainly will.
Thank you, Ms. Dunbar. We'll take a look. And that's all I see. Anyone else with access to the email?
Line paper, there was a, could you state what that was again? What type of line paper did she say?
Just line
paper?
Stationery, i.e. lined paper, available on commissary. For the last 2 months, she says it hasn't been available. So let's check on that, and Ms. Dunbar will answer you as soon as we have an answer. All right, and with that, I don't see any other comments. And I will turn to the other members of the board if there are any other parting thoughts or questions or comments before we adjourn. All right, hearing none, I will again say that we will see you again on the second Tuesday of the month, unless we have a special meeting prior for an update on the results of phase 1 of CGL's work, in which case it'll be before then. All right, is there a motion to adjourn?
Make a motion to adjourn our meeting of February 2021.
Second.
We got a second from Mr. Corson. All in favor?
Aye.
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 Opposed? All right, thank you, everyone, and we will see you next month. Stay safe and be well.
Thank you.